my people, welcome back to my channel. If you are just joining us, please like, comment, subscribe. Why not turn on the notification bell and take all, so that whenever we post new videos, you are going to be notified. You're welcome to season 5 of this our doctor series. Today we are going to be talking about the uterine or cervical causes of infertility. Remember, we started with menstrual cycle, we defined infertility and signs and symptoms of infertility. We talked about other causes of infertility like fallopian tube causes. Then we talked about ovulation causes, and today we are going to be talking about uterine causes. What are those causes that can lead to infertility associated with the womb? This is a picture telling us about a complete healthy womb. This is how it looks like. This is a complete healthy womb. It has the cervix, it has the womb, it has the fallopian tube, it has the ovaries, it has the fibr. The fibr, the another hand from the fallopian tube where they hold the ovaries, and so now they call it the fibr. So from that picture we have seen a complete healthy womb or uterus. Yeah, so now I will bring a picture of a womb where it be affected by fibroid or other associated diseases. Yeah, like today I don't talk, so we look at those diseases the way they affect womb, where it make a woman no fit carry belly. Yes, you will watch me now. So if you know if you carry belly, if all the other symptoms you don't jump and pass, this one maybe it be a problem. Why you need to carry belly? Research don't show say 1 of 3 women they be affected with fibroid, especially women in their late 30s, in between 30 and 50 years. Women they experience fibroid. Why? Because for the age, their hormone level they be high. The causes of fibroid be unknown, but people that they think say maybe it be associated with hormonal levels, estrogen and progesterone. Why? Because they don't notice and say if you by mistake you pass the level where you not catch you, women there for above 60 years they need to get fibroid, because for that time their hormonal levels they don't drop. So one possible reason why we woman in womb no be healthy, and if you make a carry belly, or when you carry belly it go drop the pikin. Now wait, benign tumor or fibroid. Wait till be fibroid or wait till be benign tumor. These now non-cancerous tumors then. Now non-cancerous tumors the way it do it is developed for woman a part of a womb. If it be now for inside, if it be for corner, like when I watch this picture, now a complete picture this of a womb where you don't be affected with a fibroid. There are 3 main types of fibroid. You have intramural fibroid, you have subserosal fibroid and submucosal fibroid. From this picture why they show now my people, when I look at when I will see the various type of fibroid. From that picture you will see and say that fibroid where it there for that different places, so it explain the different types of fibroid. For some people then when you go for hospital, doctor will check you, they will talk say where my sister or my pikin or my patient, you get fibroid too, but your fibroid is still small. Instead I advise you say make you go carry belly quick. What is the reason? The reason I say this fibroid they take time for grow. Some people their own before they want really reach a very reasonable size, so it wants to affect them not for carry belly, it will take like months. Some people they only take years. So doctor instead advise you say if you have a partner, you are married, go and get pregnant before this thing becomes a problem. So woman they just rush go carry their belly. So one day during birth, as they operate them, they remove the pikin, they go just move the fibroid one time. But some people then they are fibroid there for some particular place where they not even carry belly. Look the picture, my people. If you get the kind of one, how if you do carry belly? The only way if you carry belly na by miracle. Yes, I believe in miracle. The only way now by divine miracle, divine intervention, or you go for surgery. Yes, fibroid stay for woman skin for 1 year, 2 years, 3 years. You know, even no say you get fibroid. Some fibroid they be asymptomatic. They need to show signs and symptoms. But whereas the one they show, wait till be those common signs and symptoms they will tell you say you get fibroid. If you know, we don't even know. As you watch me now, so examine yourself. Check your menstruation. If you know say your menstruation be dey normal, you need to over bleed, you dey bleed normal. But after some time you can see and say, if you know double 6 parts, you know if you even waka, you don't waka from here to there, your pad already full up. If you notice yourself that you have heavy bleeding, of which that was not how you were before, you have never experienced heavy bleeding when you started menstruating, then you should have at the back of your mind that you might have fibroid. Painful menstruation. Some people then they rule during their menstruation. I mean, so that kind pain where you know if you even understand how they come out, they don't do all gymnastics, take medications, the pain need to go. My dear, please go and do an echography. There will surely be a fibroid somewhere you have not discovered. Another sign and symptoms of fibroid is when you have discomfort or pain during intercourse with your partner. When you feel pain, yeah, it means seriously you might be having fibroid. The only way to confirm this is for you to go and see a gyne, and then you go in for echography. By this, you will discover yourself that you have uterine fibroid. If you are suffering from this severe abdominal pain during menstruation, I advise you to use a hot pack. You would want to put warm water in a bottle and massage your lower abdominal region during menses. It will really help you. So we are going to be linking this topic with risk factors. What are those risk factors that will pose you to be a threat on infertility? Number one, you have age. We all know when you start seeing your menses at the age of 12, maybe 14, maybe 15, you are at your peak. By then, you are highly fertilized. In fact, at that level, you are highly fertile. At the age of 18, 25, 30, you are highly fertile. 35, oh yes, you are highly fertile. But as you start reaching the age of 40, 45, my dear, the fertility level drop. So age is a factor when it comes to fertility. Smoking is a factor when it comes to fertility, because smoking has a negative effect on your fallopian tube and your uterus. So please reduce the level you smoke if you wish to have a baby in the future. Weight is another thing. If you really want to be pregnant and you see yourself, one of the first things in order to start planning to have a baby, you might not be too fat or too slim for you to think that you are not fat. No, you can be as clean as this, but around your womb you have fatty tissues. So you need to first of all reduce your weight, even by 2 kilograms, even by 1 kilogram, even by 3 kilograms, thereby increasing your chances of being pregnant. If you are overweight, then you need to come up with good diet in order to boost your weight so that it could put you at a higher chances of being pregnant. Another one is sexual history. Please trace your history. Somebody might not have a cervical problem, somebody might not have a womb problem, you might not have a tuber blockage, you might not have hormonal imbalance, but your problem is your sexual history. Please check your sexual history. Maybe you have been suffering from something like gonorrhea, syphilis, any sexually transmitted disease. Please check your sexual history. You might have had one of these STIs in the past and maybe it has reoccurred. So you need to get yourself checked up and you need to get treated. Another possible risk factor is alcohol. Please make sure you reduce your alcohol consumption, thereby staying healthy and living healthy. My people, we have come to the end of this doctor series, but there is an announcement for you. Our next doctor series, that will be season 6, which will be the last doctor series for this topic. We are going to be talking about home remedies on how to boost your fertility, home remedies on how to handle your hormonal imbalance, home remedies to treat let's say missed menstruation. If you are not menstruating, we are going to be telling you home remedies on what you can do that will bring your menses back on track. If you are suffering from menstrual irregularity, we are going to be telling you, I am going to be telling you home remedies, that things that you would do in order to bring your menses on track and very, very, very regular. Please like, comment, share if you are new to this channel, so that as I will bring in the home remedies of what could be a possible solutions, yes, you will be notified. Yes, I mean you that you watch me, you will be notified. Have a nice day.